吓？唉，好啦，我哋夠人數開會。
All right, we have formed a quorum. Let's call the meeting to order. We have many meetings being held in parallel today, and some members are actually chairman of other meetings right now. That's why we do have a very tight quorum today. And we have 4 meetings underway in tandem right now in the building. So let's first welcome the guests and officials, including Professor Sophia Chen and Ms. Janice Che, and also Mr. Tommy Lee, and also Professor Zhao Zhongzhen. They are both from the Chinese Medicine Development Committee non-official members, and we also have Mr. Polly Chen. She's from the Department of Health. And at the last meeting, we came up with an agenda, and we have 3 papers which have been issued for today's meeting. And first item is on development of pCM. So we have a total of 3 papers. Can I invite the Undersecretary to walk us through the paper, please? Yes, thank you, Chairman and members. Well, in response to the request by subcommittee members, we have now submitted a paper on issues on the administration's efforts in promoting the development of pCM, including the trends of pCM and also the development of Chinese medicine, and also the overall development situation with regard to the Chinese medicine industry. So that's item 1 on the list of papers for members' reference. And as Chairman said, this is an item on the development of pCM. We all agree that in developing that, the first issue is to deal with it, and also is to ensure the safety, quality, and efficacy of pCM, and also to enhance public confidence in consuming pCM.
Well, as we said in the previous meetings, the current registration system of pCMs is very important for the development of pCMs. And the sale and manufacturing of pCMs come under regulation to ensure the safety and efficacy of pCMs, so that the public can be confident when they consume pCMs or use pCMs. And the details are in paragraphs 3 to 6. On that basis, we try to promote the development of pCMs. Now, in promoting GMP, good manufacturing practice, we are trying to further develop pCMs. Now, the mainland and Hong Kong standards, and we try to take these standards to international standards, and this is a necessary stage in the development of pCMs. And we have repeatedly emphasized that the request and of the local industry, we do not intend to impose GMP on a mandatory basis, and the government and many organizations have been providing support to the industry for introducing GMP, so that they can gradually move toward the GMP standards. The licensed pCM manufacturers, if they meet the GMP requirements, they can apply for the certificate, GMP certificate, to show that they have followed the high standards in the production. And Hong Kong is also a trading center for pCMs, and to ensure that pCMs sold in Hong Kong are of good quality, testing and certification is very important. And so the testing and certification of pCMs will help eliminate malpractices, and the Department of Health, starting in 2001, has come up with the Hong Kong Chinese medical standards, and we have established International Advisory Board comprised of local, mainland, and overseas experts, and the standards are to provide the appropriate standards to ensure the safety and quality of pCMs. And the establishment of HKCMMS is aligned with international standards, and is to provide assurance of the quality of Chinese herbs, so that there will be good commercial development, and that's in paras 10 to 15. Now, on the R&D of Chinese medicine, the Science and Technology Parks Corporation runs the Hong Kong Science Park, and there are also industrial estates, and then there is the Innovation and Technology Fund, which has been supporting universities and other enterprises in R&D, including that on Chinese medicine. And the ITF has supported over 80 Chinese medicine-related projects, and it totals over $200 million. And CE in February 2003 has established the Chinese Medicine Development Committee, and this looks into long-term prospects and has supplied useful views. And there are 4 areas: manpower training, professional development, Chinese medicine service, R&D, and industry development, including testing and certification of pCMs. And in early 2014, the administration has accepted the committee's recommendations on the HKCMMS scheme, and there will be volume 7 of the standards will be published. And there are 30 standards on 30 products each year, and there is a lot coming up also. And there has also been agreement to set up a testing center for Chinese medicine under the Department of Health, so as to introduce high standards. And the Department of Health is doing the preparatory work, and we have invited 2 members of the Chinese Medicine Development Committee to share with us the development in this regard. They are Professor Zhao and Mr. Li. They are members of the relevant committee. And also members are concerned about the registration systems of mainland and of Hong Kong, how they differ. Now, actually, there are 2 different registration systems, and at the end of last year, in December, on the 15th, we supplied the document CB 2453 1415, and there is a brief introduction of the PCM registration system in the mainland and how it compares with that in Hong Kong. I would be glad to discuss further with members. Now, let me recap. We have last time briefly discussed the issues mentioned by the Secretary, and we wish to elucidate further the HKP issue, the HKCMMS development issue, and the CMDC subcommittees, how their work is progressing. So I'd like to ask members, do you have questions? Mr. Joseph, Dr. Joseph Lee? Okay, I'll ask the questions. Firstly, now last time we discussed an issue, that is the HKCMMS Actually, it was launched in 2001 and it's now 2015. It's now almost 15 years. There are over 200 Chinese herbs for which standards have been set. And we now have over 5,000 herbs listed, herbal medicines in the already collated, and we are now having another set of standards. Is it necessary? And also, what should be the overall direction in the development of pCMs? So perhaps Mr. Lee and the professor, perhaps you can brief us. Thank you, Chairman. I'm sorry I have to speak in Putonghua. Now, just now, the chairman asked about the public's views on whether it's necessary to develop HKCMMS. And I would like to talk about my experience and make a comparison between HKCMMS and development on the mainland. And I started in the early development of I joined the early development of HKCMMS, and I am also a representative of the I was represented in the work of Chinese pharmaceuticals and national standards, and so now on the China standards, now is sets a set of standards. That's the same purpose as the HKCMMS. Now, the China standards is mainly to provide guidance for Chinese herbal medicines, and it's mandatory. As for HKCMMS, currently it's not legally binding. It is a reference set of standards. In terms of content, when we talk about Chinese medicines, now what do Chinese medicines consist of? That is the herbs, the decoction pieces, and proprietary Chinese medicines. Now these are the three main parts. Now just now, if I heard right, the chairman said that there are over 5,000 items in the Chinese standards. Now there are thousands of items, but there are 600 odd herbal medicines, and there are 800 to 900 decoction pieces. In the 2015 version of the standards, which are to be published about next week, there are about 1,000 pCMs. Now, as for HKCMMS, over the past 14 years, we have managed to complete only about the herbal medicine part. We haven't come to yet to decoction pieces and to pCMs. Now, what are the shared qualities and differences of CF compared to the mainland? Now, the Hong Kong standards have achieved most of what's done in the Chinese standards. Now, for instance, the microscopic identification. Now, this to facilitate the industry, all their colored representation, and there is also fingerprinting using current testing techniques, and then there are market compounds. Now there are quantification standards, and there are also safety issues that are also covered. Now, microbial contents, these also features in the standards. Now, after efforts for over 10 years, the Hong Kong standards also comprise the efforts, also the results of efforts and participation by mainland and Taiwan experts. And in the process, there's I think the HK standards are unique in one respect, that is right from the start in the design of the standards, the experts from the main motherland and across the straits have been invited. They are the top experts in the field. So as soon as the Hong Kong standards come out, even though they are not yet put into effect, yet from a technical perspective, the Hong Kong standards are very highly rated from an academic perspective. It's repeatable. It does a very high assessment, and all the data are based on research, and it's not merely in reference to based on reference to the Chinese standards. There are about 100 pieces of literature supporting the standards, and as I said, the merits, there are merits of Hong Kong standards, which I just mentioned. What other challenges do the Hong Kong standards face? Now, it's positioned in such a way to make a contribution to internationalization of professional Chinese, proprietary Chinese medicines and other Chinese medicines.
So after it's been formulated, how we are going to promote it to Hong Kong community as well as the mainland communities and also to the international community, because internationally there is an increasing use of pCM, and therefore broadening the use is also a very important part of it, because despite the fact that we have come up with the standards, if they are not put to proper use, then it's a waste. And as I said, for Chinese herbs and also decoction pieces, well, as far as Chinese herbs are concerned, we have now come up with some 200 most commonly used Chinese herbs and their standards. And generally speaking, we said that for Chinese medicine, it's very vague. So we have tens of thousands of prescriptions, and well, we have got over 10,000 such prescriptions. But then for the most commonly used ones, there are only about 500 plus. So about 400, 500 of them are most commonly used. That's why what the HKCMMS has done is that for the 200 herbs that are most commonly used in clinical prescriptions, well, the HKCMMS, in terms of the variety of herbs, there is still a lot of room for development. And as the chairman just said at the beginning, according to the feedback from the trade, well, in terms of the application and also, well, for doctors doing the prescription, in most cases they would use decoction pieces. For the herbs themselves, most of them would be used in prescriptions. So we will have to further develop the CMMS in terms of decoction pieces, and a lot of work is still outstanding. And looking forward, the CMMS would also be one of the main tasks of the TCM sector in Hong Kong. We will have to promote the internationalization of PCM and also international exchange, because for the HKCMMS, one of the characteristics is that is bilingual, and therefore from the very beginning, both versions or editions have been published simultaneously. So when compared to the pharmacopoeia on the mainland, they have the English version, but then they are not published simultaneously with the Chinese version, so they would be lagging behind by about 1 or 2 years. But then in the case of Hong Kong, well, even for the Japanese pharmacopoeia, they would first have the Japanese version, and then the English version would only be available 2 or 3 years later. So that's all I'd like to say about the HKCMMS. Thank you, Professor, for your introduction. From what I've heard, I think you have done a remarkable job for the TCM sector in Hong Kong, but still there is an outstanding problem. The fact that we have the CMMS, in terms of the application, as you just said, we have about 1,000 most commonly used Chinese herbs. So in terms of the use, there are many manufacturers in Hong Kong. They are already using the prescriptions of the CMMS, so they have already made reference to the CMMS. All right, we have been working on it for more than 10 years, and a lot of resources have been put into that. So in terms of the academic research, we have done that. And also, we are only looking at the herbs themselves rather than the decoction pieces. So we will go to the Chinese pharmacies or drugstores to buy that. But then, other than the academic achievement, are there any practical uses in developing this HKCMMS? Because every year, given the taxpayers' money put into it, and if we are only able to make some academic achievements and we are setting the standards at a very high level, in the end, people will question why in Hong Kong you are not following your own HKCMMS, and why are you promoting this to the international community with such a highly set standards. So, Professor, can you address this question? Thank you for your question. In fact, precisely, I think these two questions are very good ones, and you've actually hit the key points. Well, for the Chinese pharmacopoeia, should we just adopt the Chinese pharmacopoeia, and if it's to be applied to Hong Kong, would that be better than developing our own HKCMMS? And second, during the past 10 odd years, we have spent so much money. Is it good value for money? I think we will have to look at the background information. Well, when it comes to pharmacopoeia, in fact, this work will have to move with time. So going back on history, well, looking at more contemporary time. Well, for the American pharmacopoeia, internationally speaking, that's the most commonly used pharmacopoeia, and it was established or formulated in 1828, and over 130 countries are adopting this as their pharmacopoeia. But of course, it applies mainly to Western medicine, and in recent years, they've also incorporated some Chinese medicine in it. So for the US pharmacopoeia, well, every year they would have a new version or edition every year. And then for the Chinese pharmacopoeia, well, the earliest version, if we look back on history, well, it started in 1936 during the Kuomintang government. They tried to develop this. So after 1949, the two separated. So we have the PRC Chinese pharmacopoeia, and then Taiwanese came up with their own pharmacopoeia, and the most commonly used would be the Chinese pharmacopoeia, which is in use. So they would come up with a latest edition once every 5 years. Why 5 years? That's because if you look at the pharmacopoeia, there is a lot of substance that has not been included. For example, for a very long time we talk about a particular herb, and in Hong Kong you use that to prepare soup. But then in the Chinese pharmacopoeia, when you talk about this particular herb, when compared to the HKCMMS, in fact, it's very different. So in the process of formulating our own CMMS, we conducted our own field study. We tried to look at the situation on the ground in Hong Kong, because in Hong Kong, it's a very commonly used herb to prepare soup, but then in China, it's not very commonly used. So that's just by way of an example for you to see the difference. So in Hong Kong, we have to emphasize internationalizing Chinese medicine, and at the same time, we have to look at our own characteristics in doing our work. If we just this is how I compare the Chinese pharmacopoeia and the HKCMMS. And if you look at the economic figures, in fact, the investment in the HKCMMS is nothing. Not to mention the resources put into developing the USP. So I think the biggest challenge ahead is to further improve the standards. So if we have the very good standards, and if we do not use them, then that would be a waste. That's why I think for the work on the HKCMMS, as far as the government is concerned, and also for the academia, and also for the health professionals, this is a challenge. But of course, I have this suggestion to make. I think in formulating or developing the CMMS, we have to look at how it can be applied. And there should also be more involvement from the sector that would help or to do a better job. I think Professor Cheng has hit a nail at the issue. The question is whether or not it's been put to use. Well, either we don't know how to use it, or it has not been properly used. So my question is that it's not that we are not going to do it. Well, with regard to in-depth study of Chinese herbs, they are very meaningful. But then, should we position this at a level where it's just for academic research, or is it to be used for manufacturing pCM, or is it just about producing journals? Because every time when we ask the government, well, in the TCM sector, how much have you invested in it, and what have you done for the Chinese Medicine Center? All right, they said that they have spent money in formulating the HKCMMS. All right, the money has been put into developing the HKCMMS, but then as far as the Chinese medicine sector is concerned, what is the practical use of it? Because we are trying to position ourselves, all right, for the HKCMMS. The professor just told us that academically it's been widely recognized. And I'm not saying that it is of no use at all. I'm not suggesting that there is no point in undertaking those researches. But then on this particular issue, should we position ourselves, and where should we stand? Concerning how the HKCMMS should be used, yes, you're concerned about the application. So can I defer to Dr. Lau? Yes, thank you. And I'm grateful to Professor Zheng, and I'd like to further elaborate on that basis. In fact, when it comes to HKCMMS, if a member of the public, if he knows the price of a watch, then he would buy it. And of course, the watch would have the hour hand, the minute hand, and the second hand. So basically, as soon as he looks at the watch, he will know the time. But then for the HKCMMS, other than meeting the basic requirements, in fact, we go a bit further. For example, on that watch, we also have the date indicator, and for people who like to do exercise, they would also have a function on the watch that would record the time that they have spent on doing exercise. So for the CMMS, so we are trying to unify the indicators. For example, one is to indicate the standard and the quality, and also the safety. One indicator is aflatoxin, because this is and if you consume it on a long-term basis, it could be carcinogenic. So and in the CMMS, we have this indicator. Well, for the Chinese pharmacopoeia, they have covered a lot of properties, but then they do not necessarily have this indicator on aflatoxin. That's why we believe that it's worthy of a while to formulate our own CMMS other than the fact that we would have more details about individual Chinese herbs. For the most commonly used Chinese herbs, for the 200 plus Chinese herbs, they're very commonly used in Hong Kong. So in this regard, we will have a more comprehensive record of the safety standards and quality of these herbs. That's why there is a need for us to do it. What is the application then?
Yeah.
Now, we manufacture the medicine, we might not use it because we have already accepted the national pharmacopoeia standards. Now, as I said, we want the Hong Kong standards to be appropriately positioned. Will it be positioned for application or for academics? Dr. Lam? Now, of course, application is of most importance. This is not merely academic in purpose. Now, currently, the hospital authority has 18 clinics where there's cooperation between Chinese and Western medicine. And there are clear guidelines for the herbs to be supplied. Now, all suppliers have to meet the HKCMMS standards or requirements. So this is a case where the top provider of health services is helping to promote the standards. And the Hong Kong Accreditation Service and the Hong Kong Productivity Council have come up, have introduced a accreditation scheme this year for Chinese herbal medicine. Now, this is to allow the suppliers of Chinese medicine to apply for a certain kind of Q mark. Now, so these medicines have to be under a quality control system, and these medicines have to meet laboratory testing requirements set by the Hong Kong Accreditation Service. So when the public buys Chinese herbal medicine, then they can watch out for this kind of certification. Now, and as the chairman said, we realize that we need to do more on application. Now, we do enjoy an advantage, as Professor Zhao mentioned. The HKCMMS has very high acceptance internationally because the HKCMMS has its unique quality, that is, we are backed by the government-run laboratory to go through all the tests, and also our international advisors committee go through each of them, and so the EU documents show that they are quote from the HKCMMS data. So we need to go further to promote the application of HKCMMS. And as the Undersecretary said, with reference to the policy address, we try to establish the testing center so that the HKCMMS will be further recognized and promoted. Now, having heard from the speakers, it will appear that the administration has invested resources mainly in the areas mentioned by the speakers. That is, we have come up with a set of standards with over 200 medicines, and we still need to have come up with standards for the other 300 commonly used Chinese medicines. and there's still some question on how widely the standards will be applied. And in the future, when the government invests resources into Chinese medicine, please don't just tell us what you have done in the area of HKCMMS. As Dr. Lam said, the HKCMMS currently is not very widely applied. Would that be true to say? Now, it needs to be taken further in terms of application, and other people have to use this set of standards. It's like we have come up with an aircraft carrier, but some people don't know how to use it. The aircraft carrier cannot enter Victoria Harbour. It can cruise around in the outer waters, and maybe it can only enter Victoria Harbour when the harbour is further dredged. Now, the administration shouldn't just tell us how much it has invested in these standards to help development of Chinese medicine. Dr. Lee, Joseph Lee. Now, Dr. Lam said that the Chinese pharmacopoeia is that these standards are like a watch, or maybe it's like a manual. No, that's the Chinese pharmacopoeia. Now, as for the HKCMMS, it's not a manual, it's not a watch. The HKCMMS, as I understand it, is a set of standards. Now, you are going to have standards of 500 medicines, you have done 200. Now, I hope you would further clarify these 200 medicines are now certified. So when you put your mark on it, people will realize that they are safe and reliable. Now, no matter what's written on the Chinese pharmacopoeia, now Dr. Zhao mentioned this Chinese herb. That's now. If this herb is not certified, then there might be a problem. Now, so that's the purpose of HKCMMS. Now, what does this have to do with the regulation of Chinese medicine? The administration has invested all these resources for the purpose of regulation of Chinese medicines. Now, it's said that the government uses the standards and it uses GMP. Now, maybe the standards are Hong Kong version GMP. So, like the Chinese herb that I refer to, people would feel safe only when it's certified under HKCMMS. Now, you are building a platform to regulate Chinese medicine. That's important. Now, otherwise, people don't know what the standards are for. Now you have a blueprint, and you have a timetable, and so people will be clear. So the Chinese medicine clinics will understand that they need to buy these medicines to be in order to have confidence and to instill confidence. Now, I don't know whether the Chinese medicine hospital will be built, but such a hospital would use only medicine certified under HKCMMS. maybe not all medicine certified under the Chinese pharmacopoeia. Maybe that's the purpose of the HKCMMS. So if you tell me that HKCMMS has to do with the regulation of Chinese medicines, I think that's relevant. Now, I don't know how the administration would respond. Perhaps Dr. Lam can further explain on the HKCMMS and what it has to do with regulation of Chinese medicines. Now, whether it's the Chinese pharmacopoeia or the HKCMMS, they are both standards. Now, the Chinese pharmacopoeia, it's a set of standards for the law enforcement authorities, and it's a set of basic standards. But on top of that, the HKCMMS has more details and particulars, so it's a enhanced set of standards. It's not mandatory, it's voluntary. Well, is it unrelated to regulation? I wouldn't say so. It's not totally unrelated. Now, say a Chinese medicine trader, when it finds that the medicine reaches the HKCMMS standards on heavy metal and pesticide residues, etc., then he would have achieved a certain quality level. Of course, we have other ways to check whether Chinese medicines meet the standards in terms of heavy metal, etc. Is Mr. Lee who wishes to speak? Mr. Lee, any views? Now, as a representative of the industry and as a member of the Chinese Medicine Development Committee, I have listened to the speakers, and I would like to say that it's not a matter of positioning of the HKCMMS. It's how we want the Hong Kong Chinese medicine industry to be positioned. Is it to be more forward-looking, to be more international in outlook? Now, for us to promote Chinese medicine internationally, we must be forward-looking in our perspective. Now, we have spent many years on the HKCMMS. We've come up with standards on 200 medicines, so we can't achieve everything within a short time. So I think it's worth praising that the government has adopted a forward-looking perspective, and the member is right. We have to set priorities in the deployment of our resources. If Hong Kong is to be a testing and certification center, how can we achieve that unless we have a set of standards of our own? And also, to support the industry, we don't just use the HKCMMS. That's why 2 years ago, we have established the Chinese Medicine Development Committee. We have held many meetings to listen to the views of the industry. And we discussed many matters related to the development of the industry. And so there's this testing center, which comprises a number of laboratories and so on. And this is a result of listening to the stakeholders. And we also listen to the public. And we want to do more high-end work. So it's a dual-track approach because the rest of the industry is not yet ready. Now, if your company is ready, you can aim for a higher level. Now, for long-term development, certainly we can do more in applications. Now, there's one advantage to HKCMMS. It's repeatable. When the industry does the testing according to HKCMMS, we don't have to establish or develop our own techniques. So, of course, one must accumulate our efforts to reach a certain level of application. Once the standards have been in operation for a period of time, I believe ultimately the HKCMMS will be widely applied. Now, we find, okay, we don't have standards on the decoction pieces, so we have decided, and we've listened to the public, to the stakeholders, we will extend our work to the decoction pieces. So on positioning, do we want Hong Kong to be an international center for the development of Chinese medicine internationally? So I think Mr. Lee has clarified the picture. Now, the HKCMMS, the government has invested resources in it to establish a set of standards.
That reminds me of Western medicine, because initially, before the handover, well, when we didn't used to have many pharmaceutical companies doing that, that's why most of the drugs would have to be produced by a couple of manufacturers or pharmaceutical companies. So we don't have our own standards. So we don't have our own standards. That's why they either use SDA or BP, and then after you've measured it, you can get the license, and then you can sell them. So in the past, we used to do that, and now we have GMP for Western medicine. And then in Hong Kong, we always we have all been having Chinese medicine, and we just had the traditional Chinese herb stores. So instead of following the Chinese pharmacopoeia, we develop our own standards. So whether or not it's about accreditation and so on, and if we were to manufacture our own pCms, we have this set of standards. If that is the case, then that would be okay. So after you have produced the pCM, you can stamp it. You can stamp the HKCMMS on it, and then if you are selling that to the US or other countries, then that would better position ourselves. And how is it going to converge with the Chinese pharmacopoeia? Just now, Dr. Lam said that Chinese pharmacopoeia is a set of standards, but then if we can have our own standards, then we are going to localize it. Well, I am a layman. I know nothing about it. I don't know in the process of manufacturing pCM. So if we are trying to localize it in Hong Kong, so once this is localized in Hong Kong, then will there be a difference with the Chinese pharmacopoeia? Okay, if you tell me that yes, there is, then I will ask why do we have to develop our own standards instead of following theirs? You might say that we have our own climate and specific use of these herbs, and so if you want people to have confidence in using our own standards, all right. On the mainland, the Chinese pharmacopoeia might not have commanded a lot of confidence in the international community. That's why you're trying to invest a lot of resources in that in order to come up with a set of standards that would be recognized internationally. So if that is your aim, then you will have to insist on doing that. And then, despite our criticisms, if you just stop it halfway, in the light of in the light of our criticisms, then it's not good. So if you're telling us that in a few years' time we're going to have our own standards equivalent to the FDA or other international standards, so that when people buy any Chinese medicine, they will have to measure it against the HKCMMS. All right, that's very clear. So it's about positioning ourselves and also developing our own standards. And we also have a duty, so that when you regulate such practices, the HKCMMS would also be the standards that you will be using to measure other people's herbs against yours. Or else if you just buy a cup of Chinese herbal medicine, or buy a turtle jelly, all right, if you can legislate them, then of course I wish you good luck. But then if I understand it correctly, I think this is a very simple and direct thing about setting our own standards. Well, I'll defer to Dr. Lam. I think his understanding is correct. Thank you, Dr. Lee. All right, Dr. Lee, you try to interpret it from the perspective of your profession. I think you really get it. You really got it right. So for Chinese herbs that can meet the that can meet the Chinese pharmacopoeia standards, they would definitely meet. If they can meet the HKCMMS standards, then they would definitely meet the standards of Chinese pharmacopoeia. And of course, we would like to develop it into a set of international standards, so that for the entire sector in Hong Kong, they can also become the pCM hub. That would enable us to have a better understanding, because we do have the duty to regulate. So can you come back on a regular basis to tell us the progress of its development, and when we can complete the whole project, so that the public can be rest assured, all right, despite the money spent on it, we have already made a lot of progress, and by a certain time we'll be able to converge. So we have to know it, or else you'll be criticized for doing it behind closed doors. Well, I have to clarify one thing. Just now, Dr. Lee said that the standards can be used to measure our own products and other people's products. If that is the case, then that would be rather shocking. Well, I can measure it, I can use it to measure my own products, but then if people think that is a good set of standards, then they can also measure their products against our standards. So it's like the FDA standards and so on. So are we going to use that to apply to our own products, or what? Dr. Lam? Well, this set of standards will definitely be applied. And as I said just now, so if you can pass the standards, then you have already met the basic requirements. If you're able to meet the requirements under the HKCMMS, you will definitely be able to meet the regulatory requirements. Well, as Dr. Lam said, for the 18 Chinese medicine clinics under the HA, in the tendering process, they would decide on the herbs to be sold to the HA. You will have to meet the HKCMMS standards, and the HA would also regularly examine the herbs being supplied to them, so they would also measure it against the HKCMMS standards, which are being used in the tendering process. That's why we have been using it already. And the purpose is to ensure the quality and efficacy of the herbs, so that they would meet the set standards. So in the long run, this set of standards will help the sector or trade in Hong Kong. That is, when they try to sell herbs from Hong Kong, then there is a quality assurance, because the standards have been applied. And the method is that every time when the standards are applied, it's repeatable. So that's the characteristics of the HKCMMS. Well, all right, we have 18 Chinese medicine centers, and we are using the HKCMMS standards, but then we are not having decoction pieces standards yet. So if I'm just importing decoction pieces, then what is going to happen? Since the HKCMMS still doesn't have that standard, well, the difference between decoction pieces and Chinese medicine is that there might be further processing of the decoction pieces, and according to the HA, what they would require of the herbs, well, they would require them to be cut in a simple manner. So they are not asking for extracts, and therefore the HKCMMS can apply to these herbs. And of course, we are not talking about 100% applicability. That's why we have also accepted the IAB, the International Advisory Board's recommendation. That is, for the next stage, we will be extending our research to decoction pieces. But then, according to the HA, there are many herbs that can apply the HKCMMS standards. Can you provide us with some information so that we will know as to which herbs are being used? Well, we will give you some examples because we'd like to know exactly out of the 18 Chinese medicine clinics of the HA, how many herbs have been tested against the HKCMMS, so that if the trade says that it's not useful, then we can at least tell them that it's been used in HK clinics. Well, can I interrupt? Well, of course, I'm a layman. All right, the only thing that I consume is turtle jelly. So, are there any granular? Are there any pCms that have used the HKCMMS as the manufacturing standards? Well, for the HA Chinese medicine clinics, I don't know what kind of pCM they have purchased. So would they be preparing the Chinese herbal tea for you, or would they be giving you the pCM herbal tea? So can you provide us with the information? Dr. Lam, well, the HKCMMS has been formulated on the basis of Chinese herbs. So the application is only on Chinese herbs. But then for pCMs or granulated drinks, well, that might not be applicable. But then assuming that for an enterprise which is to procure herbs, if they can procure CMMS herbs, then that might help. Well, are you aware of any manufacturers procuring herbs on the basis of HKCMMS? No, I'm not aware of that yet. All right, as far as I'm concerned, HKCMMS is something new, but then for those in the trade, this is nothing new. So for, well, the HKCMMS has been developed for such a long time, so from the very beginning, in terms of the application, to what extent is it being used for those who are in Chinese herbs? So would they be using that for different Chinese herbs, or would that be used for Mesona chinensis? And if you were to produce a particular drink, then you will have to make sure that the herbs would be up to the HKCMMS standards. So at least I'll have to know that, or else I don't know how it can be put to good use. So I'd like to know a bit more about this. All right, I've already arranged for a site visit. All right, on the 27th of April, we will be visiting the Taipo Industrial Center. We'll be paying a visit to the Hong Kong Testing and Certification Center. We'll see how the testing is done, and we can also ask them about the HKCMMS. And Dr. Lee, you are welcome to join. All right, Mr. Lee. Well, let me explain this to Dr. Lee. Well, as Dr. Lam just explained, well, when we talk about registration of Chinese medicine, we are not requiring them to meet the standards of the HKCMMS for individual herbs. So they are only required to produce a sample for testing, and with regard to source materials or starting materials, or if it's decoction pieces, would that have to be tested precisely if we have the HKCMMS, then that would provide a standard for the manufacturer. So it's not about testing the pCM against the HKCMMS. All right, we have already spent an hour on this item. Yes, Mr. Yu Siwing. Sorry, I was attending another meeting. That's why I was late. So for the first subject, I don't know if we have discussed that already. Well, we have only been discussing the CMMS. But what about development of pCM? That would also cover the development of HKCMMS, is that right? Well, the first item is about development of pCM. Okay, so we have not yet discussed the item on the development of Chinese medicine, right? We are already on the item. Okay. I'd like to ask a question about the purpose of this, or the objective, whether it's the HKCMMS. In the policy address, the Chief Executive said that a testing center will be set up by the DFH so that we can establish a world standard or world-class testing center. And also in 1999, we could see that the ITC has also set up a fund for that purpose. So for the Chinese medicine sector in Hong Kong, all right, initially, when Mr. C.H. Tong, the former CE, said that he would like to develop Chinese medicine in Hong Kong, we have already got a plan that has been underway. And looking at para 18 of the paper, since the establishment of the fund, some 80 Chinese medicine-related projects with a total funding of about $200 million have been supported. So is it that since the establishment of the fund in 1999, that's the amount of money that has been spent? Or is it just the money spent on the 80 Chinese medicine projects? If that is the case, then since 1999, in terms of the development of Chinese medicine, how much has been spent on this? So I'd like to know exactly how much has been spent on the development of Chinese medicine since 1999. Thank you, Mr. Yu. Well, for the $200 million referred to here, I think it's about the funding on the 80 Chinese medicine-related projects. So that's the amount of money spent since the establishment of the ITF. And what's your second question? In para 17, you referred to the establishment of the fund in 1999. So Chinese medicine is also one of the areas being supported by the fund. So you've been spending money on that, right? And you've been doing that, and some $200 million has been spent on the 80 projects. And now we're talking about some 18 or 16 years since the establishment of that fund.
Well, how much money has been invested in these? We don't have the information on it. I'm sorry. Now, on the investment, this is under the ITF Commission, IT Commission. Now, the total amount invested since 1999, I think we have to ask or discuss with the Investment and Technology Commission. Now, you want to develop the HKCMMS into world-class standards. So that's your objective. Now, the ITC is doing some work, and the ITF has invested $200 million. So the objective is that Hong Kong should become a world-class center with the HKCMMS standards. So how much will be invested, and how many departments are taking part? So we have an international or world-class herbarium or international world-class pharmacopoeia, and so do we have a timetable, how we'll spend the money, and what's the ultimate objective? Do you have a blueprint Now, I understand that Mr. Yu wants a blueprint. Perhaps Dr. Lam can explain. Now, the HKCMS is mainly under the Department of Health. Of course, they have a committee comprising of local, mainland, and experts, as well as experts from other countries. Now, if someone wants to undertake R&D, he can apply for funding. So this is at the initiative of the person or organization. Now, as the Undersecretary said, our management is focusing on the HKCMMS. Now, our objective is a sustained one. Now, as explained just now, the establishment of the HKCMMS is to fulfill certain objectives. So the committee of the International Advisory Committee has decided that it's worth investing in. How much will be involved? The amount will vary. I hope to be accurate, so I'll provide the figure after the meeting. Now, the objective, as I mentioned, is that we hope to come up with standards for 20-odd to 30-odd standards for 20 to 30-odd products, and we hope to extend the standards to decoction pieces because they are popularly used. And when the Chinese Medicine Testing Center is established, we can then direct our resources to high-end research. Now, testing and certification of medicines can go beyond what we have now. Now, on the participating departments, now apart from the Department of Health, we have many research partners, including the 6 local universities, the Taiwan Medicine on Chinese Medicine, and also the relevant mainland organization, and the government laboratory has also provided a lot of support. So there's the Department of Health and the government laboratory. Mr. Yu's question is whether we have a blueprint. Now, we want to internationalize Chinese medicine. Mr. Yu wants to know about the blueprint. Does the government has a plan to make Hong Kong Chinese medicine international? Do we have a blueprint? Now, first, we want a world-class Chinese medicine herbarium. We have a system for tests. We have a plan for our investment. Otherwise, we wouldn't be world-class. We wouldn't command the authority. Now, on innovation and technology fund, you say we're not sure how much money they spend. Now, this is not just for the herbarium. We need to know what is the objective, how many departments are getting involved, and the total amount of resources. And then the Department of Health might be the focus its efforts on the herbarium. So you need a clear division of labor, a timetable, and a budget. These are the basic things. Otherwise, it's just a piecemeal by one government department. Now, people will be confident about the work on the mainland and in Taiwan because they have done the work for many years. Are we saying that we are going to be world-class and they are not? So you have to be clear in your positioning. This is what the chairman referred to as the blueprint. Now, what departments are getting involved, how much will be invested, and what will be the objective, what is the relationship to the mainland and Taiwan counterparts. Otherwise, it wouldn't command respect and authority. Professor Zhao, let me answer in Putonghua. Now, just now, it's been now we've talked about the positioning of the testing center. Now, I sit on the Chinese Medicine Development Committee, and I also participated in the discussion on the testing center. Now, you mentioned the herbarium is world-class. Now, what are the objectives? Can it be international or world-class? Now, there must be systematic standards involved. Now, as a herbarium that is international in nature, now it doesn't necessarily have to be the largest of its kind. That's not quite possible in Hong Kong. Now, it's possible, however, for it to be a international herbarium. Now, in the UK, they have the herbarium of international standards. In Hong Kong, we have collected a large number of herbs. Now, we have the original herbs. They come from all parts of China. Now, these are unique, and they are not found even in China and in Taiwan, and also it's not found in the U.S. Now, I'm at the Baptist University. We have an authentication center. It's sponsored by the Bank of China, and the industries gave a lot of support, and after 10 to 20 years of effort, now this herbarium, even though it's 150 to 200 square meters, it's listed on the list of herbariums internationally, and the data it provides is of the highest authority and is well recognized even in the U.S. Now, I'm talking about the government. Now, I think the government is building a foundation, so there are technical possibilities. Let me respond briefly. Now, the industry is also concerned about the blueprint. Members of the Chinese Medicine Development Committee have been talking about blueprint right from the start. We have come to a conclusion after all these years. We need to have a Hong Kong testing center. Now, it's not just a testing center. It covers many things. And one item is the herbarium of international standards, but it's only one item in the contents. There are many other items. There's training, technical support center, collaboration, laboratories of international standards. So if the industry wants to achieve certain objectives, we will do our best to help them. So I also like to ask now, how much money will we have? When will we really get started? So the administration should come up with a budget, and we hope that the LegCo members will approve the funding so that it will come into being as quickly as possible. Mr. Lee, so is the objective the testing center? Now, Mr. Yu talks about the objective. Now, we want to have world-class medical industry, Chinese medicine industry. Now we want to comply with to meet international standards. Now HKCMMS is bilingual, and both versions come out at the same time. Now the Chinese Medicine Development Committee, now they're talking about the testing center as referred to by the policy address. So this is basically our blueprint. We want to find a site. Then we hope that this site will house all the various projects that we are talking about. Now, it's not yet achieved, but we will certainly embark upon the work because it's mentioned in the policy address, and Dr. Lam can tell us more about the blueprint.
Well, a lot has been said about the testing center just now, and as has been said, well, please don't think that it's just for testing. In fact, the blueprint is very broad. In fact, there are 4 purposes. Well, once the center is set up, the purpose is to establish standards for the most commonly used herbs in Hong Kong. Well, sorry, I have to leave for another meeting. So in terms of its quality, safety, and also the testing methods will have to be standardized. And once these standards are established, so that's the formulation of the HKCMMS, right? Yes, that would be part of it. So we will also have to align ourselves with the international practice so that there would be international recognition. So there would be a series of collaboration program for follow-up. And through the establishment of standards, we will also be looking at the application and the methods or methodology so that the trade will adopt those methodology which will be recognized by the international community so that we can internationalize the trading of Chinese medicine. And through the trade, the final objective, we will come up with a number of measures as some members are concerned whether or not the application can be further promoted. So through the testing center, we will devise a number of measures so that the trade will adopt the standards that we have established and also the testing methods. In the end, we will be able to ensure the quality and safety of the products in order to ensure public health. So in terms of the functionality of the testing center, first of all, we'd like to establish a number of laboratories which are recognized by the international standards. And the government laboratory itself is also an internationally accredited laboratory, and it also has some collaboration projects which are recognized internationally. So that will also help us conduct such reference standards, and we will be doing that in collaboration with the universities. And second is about the setting up of the herbarium. So the most important thing about the herbarium is to come up with the samples of some herbs, and there are rare herbs or Chinese medicine or even decoction pieces. And through this herbarium, we would be coming up with some electronic version of these herbs, so that you don't really have to go there. You can even browse them online. And the importance of such a herbarium is that in many places, when they try to authenticate the real ones from the fake ones, then of course they will have to check it against the records on the herbarium. For example, in the UK, well, they have a world-class herbarium, and that's in Kew Garden. And from time to time, they will also have to do some authentication of certain herbs. So they would be invited to look at their present repository in order to check if a particular herb is genuine. So given that we will be developing the standards for Chinese medicine, so in the herbarium we will definitely have samples of the herbs, and we will also have samples of the decoction pieces. And once the standards are developed, once we have very mature testing methodologies and technologies, we hope that our testing sector can also be developed more robustly. So all the technologies would also be transferred to the testing and certification sector, so that they'll be able to make use of such technologies to provide testing and accreditation services. And just now, members were also concerned about the collaboration for internationalization. We have already established our platform. First of all, the DFH has got this unit, which is a WHO accredited center. And we have also taken part actively in the collaboration network in the international arena. For example, the pCms and also the Western Pacific Region Collaboration Center. So we have been actively involved in such, and we are also promoting the CMMS there. And as I just said, well, when we look at the pharmacopoeia in EU, they've also made reference to the HKCMMS in developing their own pharmacopoeia. In other words, if we are able to further internationalize our standards, so long as Hong Kong's Chinese medicines are able to meet the HKCMMS standards, then it would mean that they would also be able to meet the overseas standards, because their standards have taken reference from our standards. We hope that by adopting this approach, we'll be able to move forward. Yes, Mr. Yu. All right, on another subject, can I suggest this? From what I've heard, all right, well, as early as 1999, we already started the study on Chinese medicine. And the purpose, from what we have heard, yes, you've got it. And we do have some long-term targets. So you're going to set up this testing center, and the administration is willing to put in resources for that. But then what we lack is, well, for the DFH, which is the leading organization, it should have a very clear objective. For example, how many institutions will be involved, how long would it take before we can achieve those objectives. I think we have to have a clear roadmap. But then, yes, a lot has been done. Still, we don't see a very clear roadmap, and also how many resources will be involved, and also what is the division of labor. All right, you're not even able to tell us exactly how much has been spent since 1999. All right, the DFH is the regulator. In terms of development, well, it should have been the job of the Bureau. That's why, maybe, in terms of the regulation, they might have a better idea. So it's difficult. It's also your responsibility, because the CMDC is under us. So I think you can just come up with a sketch map or a sketch, so that we will know 5 years down the road to what extent will Hong Kong's Chinese medicine sector become a world-class sector, which is recognized by the mainland Taiwan and overseas countries, instead of just telling us that you have done a lot and you have already formulated your own CMMS. But then the most important thing is to get international recognition. Okay? We have spent a long time on this already. I'd like to give my comments for the subcommittee to consider, because earlier on we have organized some public hearings and a number of suggestions have been made so as to enable the Chinese medicine sector to further develop. Alright, we talk about the standards. We need the whole trade to be involved in order to do it. In the past, we have asked the administration as to whether any funds would be set up to allow the trade to upgrade their facilities and to allow the trades to conduct more research and studies. Well, apparently there is no dedicated fund for that purpose. So we hope that in the future, the administration can consider it. Alright, we have already got the Fisheries Development Fund and also the Agriculture Development Fund. But then in developing Chinese medicine, we have never had a dedicated fund for that purpose. So can the administration consider this? Second, in terms of legislation, yes, in the actual operation, there are many problems. Well, it's been more than 10 years since the enactment of the legislation. I think it's time for you to conduct a review. In our next item, we'll be discussing issues relating to that. So is it time for us to review the situation and whether the law is able to cater for the needs? So in terms of Chinese medicine developments, actually we're tying our own hands, and therefore it's time for us to relax, to get rid of such constraints. Yes, we would like to go global, but then we should also go to the mainland. So you said that worldwide, which place is using most Chinese medicine? In fact, is mainland China. But then in terms of collaboration with the mainland, what are we doing? Yes, you might say that we are asking them to accept or adopt our standards. And the administration might be saying, all right, there are so many Chinese herbs from the mainland, so how can we cope with that? Well, let's not forget that our market has only got 7 million population, and on their part, they have 1.4 billion people. So what we should be doing is that whether we are doing it through CEPA, we will have to enable our Chinese medicine to go onto the mainland so that the manufacturing sector will have a major market as a backup, so that wherever we go, we will have no problems at all. But then the biggest market is behind us. Still, we've been thinking about internationalization. We have never thought about going into China. So how are we able to promote our Chinese medicine on the mainland? And the government should be playing a better role in this regard. I also hope that these views can be passed on to the CMDC for consideration. Well, at the public hearings, these are the views that have been given to us by the trade. And another one is about the transitional arrangement. So how are we going to smoothen the process? All right, on the 30th of June is going to be a deadline, and we'll be discussing that later. And also for the migration from HKP to HKC, all right, during the 6-month period, what are the arrangements? Of course, the administration is saying that these are the legal requirements, but we will be listening to the members of the CMDC. So how are we able to deal with that? Just now, many members have talked about the HKCMMS. It's not that we are against the formulation of the HKCMMS, but then we'd like to know better as to why we have to develop that. Will we be able to make very good use of it? Are we putting taxpayers' money into good use? So we are not criticizing you. We'd just like to get a blueprint from the administration. Yes, Chinese medicine pot has gone, but then we believe that there is room for development for the Chinese medicine sector. Well, as you can see, many mainlanders are coming to Hong Kong, and they are buying up a lot of Chinese medicine or pCms. So we can see that there is a lot of room for development, and I hope that the government can help us in this regard. So there are 4 issues that I've raised just now. Under Secretary, would you like to respond to that before we move on to the next item? Or can we invite Professor Zhao or Mr. Li to respond to that? Yes, thank you for your comments. But as the chairman just said, the views that you just made would be brought back to the CMDC for discussion. And of course, right now, as you just said, should we set up a fund and should we provide better support to the trade? In fact, the CMDC is also discussing these issues, and they can also consider this in greater detail as to what kind of support would be the best for the trade. As to the other issues, your views will be conveyed to the CMDC for consideration. Yes. Mr. Li or Professor Zhao? Mr. Li, thank you, Chairman. You talk about setting up a fund to support the trade, and if you ask the trade, well, I'm sure none of them would say no to it, because providing better support to the trade is of course good, and that's what we should be doing. But then how can they apply for funding support, and for what purpose? Well, if there is funding schemes available, in fact, in the community, we've been working with a few associations, and shortly we'll be coming up with a topical survey that is in the process of Chinese medicine registration, or in the development of Chinese medicine, what kind of funds would be needed, and which area is most in need of funds, because we cannot expect the administration to come up with infinite funding for this. But then I'd like to thank the chairman for your kind intention, and as a representative from the trade, we are very grateful, and as soon as we have come up with a plan, we'll be getting back to you, and at the CMDC we will also be deliberating that, and we'll be reporting to you on the biggest need of the trade and what needs to be done to support them. With regard to review of the legislation, well, as far as the trade and the government are concerned, we all know that the legislation has been in place for more than 10 years, and we all know that there are problems, and therefore we have to see how we can deal with that. Well, many people have said, well, no, nothing can be done about it, because those are legislative requirements. But then, as you said, on the migration from HKP to HKC, and if the law says that, well, as soon as you have HKC, then HKP will become void. So that's what the law says. Yes, that would cause some inconvenience.
So whether it's the CMDC or the Chinese Medicine Council, and together with other associations, we have supplied our views to the administration. We hope that there would be time for the HKP inventories to be consumed before they get the HKC, and the government has said that there will be a period of time, grace period, or transitional period. Now, if there are difficulties, we would be able to talk to the regulators. Now, okay, that sounds fine. However, if there is no simultaneous migration, there might be problems. Say there are a number of chain stores, say 20 of those stores have sold out all the old products, and but not in the others. So there would be a lot of administrative work. Say, and that's just one company with say 50 chain stores. So of course you should give them a time limit, say 3 months or half a year, but the law doesn't allow it, so the trade is disappointed. So we hope to hear from members on your suggestions. Now, the law does cause some problems. So both the administration and the industry will try to get some information and see which legislation have to be amended. Now, as the member said, you want us to do GMP or whatever. If we invest so much and yet the returns are low, if we only sell our products locally to 7 million people, not a good investment. If you can help the industry to break out into the international arena, of course we would welcome that, or into the mainland. Now, say there are 5,000 or 10,000 Chinese medicines. Most of them come from the mainland. They are registered in Hong Kong as well. There are a lot of products right now from the mainland. Now, you are right. Our products face stiff competition from the mainland products because they have a clientele of 1.8 billion people. So you may invest a lot of resources to raise your product standards or to have quality certification. Now, if people see the incentive, they will be willing to go ahead. Now, for the HKCMMS, it should be developed in the longer term, because unless we have such standards, whether it's GMP or whether a certification system, you still cannot succeed. You need to assure people about the quality. So why is not the HKCMMS widely adopted right now? Because it takes a period of time for repeatability and widespread adoption. The hospital authority is already adopting HKCMMS for the tendering exercise. And some people in the trade are also adopting the HKCMMS when we do our purchasing. So we have to do it step by step, and there's certainly a need. Any further comments? No? So we come to the next item of agenda, that is to further discussion on the registration of pCms and the arrangements for migration from HKC to HKP. And June 30th is the deadline for submitting the information. Now, if they are unable to get HKC by that date, they can continue to sell their products, but the trade has many questions. I have not been able to find people to do the certification for me, or I haven't submitted the information, and the government says you submit it first and then it will be accepted. Now that has not changed, right? I'd like to clarify. Now, on whether there can be acceptance, now the Chinese Medicine Board have to discuss on the proposals. Now, in my experience, the trade can furnish some grounds. And the CMB might agree. When we discussed this last time, Dr. Lam said that he would discuss with the go back and discuss with the Management Council. Now, is there a conclusion now? We have already reflected the views. And the Management Board has to collect certain data Now, how many have supplied the information now, and whether the CMB will take some time to evaluate to see whether the reports meet the requirements, and the CMB will certainly meet in May. Professor Chen. Now, I think there are two aspects. Now, the last time we met, the trade mentioned that the HKP holders received the notice of confirmation of transitional registration, and they can choose the effective date, and they have to complete the change in the inserts and so on. And it's been said last time that 6 months is not enough. Let me supplement. The CMB has decided to adjust the deadline, so there's an extension from 6 months to 12 months. If individual product holders need a longer time period, they can apply to the CMB. They can extend for a further 12 months. That is a total 24 months. Now, the CMB has discussed with the trade and has received the support of the trade on the adjustment. Now, usually the validity, useful life of pCms are for 3 years. So this will allow for this linking up. Now, people are concerned about the June 30th date for submitting reports. Now, in the CMB in March 2003 has published a manual for application of registration of pCms, and according to the CMB original arrangement, HKP holders need to before 30th of June 2009 have to submit the quality reports and stability reports, and because there are difficulties with the stability reports, a longer period of time is needed for the testing. The CMB on 2 occasions allowed for the extension of the deadline for submission of these reports. So it's been extended from 30th of June 2009 to 30th of June 2011, and then to 30th of June 2015. So in fact, the trade has had more than 10 years to prepare the reports. And given the difficulties of the trade, last year the CMB has enhanced some technical requirements for these reports so as to speed up the assessment of the HKP cases. Now, for the long-term development of pCms, we need to complete the transitional arrangement, and the 30th June 2015 deadline is just the first step, and the Secretary for Food and Health will need to decide when to gazette the effective date of registration, which means that after that date, the HKP registration will no longer be valid. And we suggest that the CMB has to start a discussion in this regard as quickly as possible, make a proposal to the SFB so that the industry can be notified and have time to make the preparation. Dr. Kokaki? Now, I think I understand this transitional arrangement, but as the Undersecretary said, it's been there since 2003. Now, it's 12 years. Now, the deadline was originally 2009, and now it's another 6 years that has been extended to 30th of June this year. Now we have to bear public interest in mind. I'm sure that many in the industry are producing good products, and many have already migrated to HKC. But I am a bit concerned now how long we can keep extending. We understand the difficulties of the trade. At the same time, we must provide safeguards to the public. Now, some responsible pCM manufacturers have done all the formal registration, but it's been over 10 years since 2003. Others have not. So what's the problem? They haven't been able to complete the preparation in 2009 and not even right now. Of course, if they have difficulties, we will try our best to help them. However, for some of those in the trade, they don't even intend to let their products be tested. They just want to drag on for as long as possible before they terminate their business. So in the meantime, the public has no safeguard. So when will these extensions come to an end, and how do you safeguard the public in the meantime? Now we have seen many complaints in the media, and some patients have suffered in their health as a result. Now, has the administration been lax in this regard? How do you safeguard the public, even though you manage to look after the interests of the industry? People rely on the Department of Health to be the goalkeeper, the gatekeeper. Now, I thank Dr. Kwok for his comments. It's not for us to decide on the extension. It's actually a decision by the CMB. As I said, it has extended the date several times, and now it's 30th of June 2015. Do you know that when we were scrutinizing the legislation on inappropriate advertisements, we were already waiting for them. Now, we are not saying that it will be further extended. Now, we must try to complete as quickly as possible the transitional registration arrangement. This is the first step.
And the committee would also have to discuss it further, and it's also provided in the law that the secretary will be appointing a date, and that would also be gazetted, and the date will mean that if you've only got HKP registration and if you have not submitted an application for migration to HKC, then that would become void. All right, you've already given them the deadline on the 30th of June from 2003, so it's been 10 years. So in the, is it appropriate for you to gazette the specified date within 2015? Well, as I said, it's not decided by us. It's decided by the CMB. So it's a recommendation by the CMB to the Bureau. And of course, there is this demand. But then, as I just said, we also have to complete the transitional arrangement as soon as possible, because there have been a few extensions already. What about the health concern? Yes, we have been acting as a gatekeeper. Yes, thank you, Dr. Kwok. As you said, we have to strike a balance. First of all, for the registration system for Chinese medicine is a very stringent system. I'm sure members understand this. Number one, for pCMs, which have already got HKP registration, they have already got a history of sale. So we are talking about over 20 years of sales for these pCMs, because we're talking about 2003. And for them to get HKP, they will have to pass some basic tests in terms of toxicity and so on. So after they have met those criteria, well, it's like regulating Western medicine. on a regular basis, we would be conducting surveillance in the market. I can give you a figure. In 2014, on pCM, we have already taken over 2,000 samples for testing. And for the failure rate, well, for example, for some microorganisms that have been found and so on, well, according to the figures that I have, there was 7 cases that failed, so it's less than 1%. And for the adverse response report, well, whether it's doctors or other healthcare professionals in the process of their consultation, if they suspect that something has to do with Chinese medicine, then through the established mechanism, they can also provide feedback to us. So from the time when the pCM is registered to the time when it's available on the market, we have got sufficient checks and balances in place. So I believe that the situation is okay. Next, UC Wing. Well, you started that in 2003, and it's been 10 years, and if you offer an extension every time they ask for it, then they would have this expectation that every time when they ask for it, they'll get it. Or else they would come up with different excuses, and then there would be infinite extensions. So I think what the public are concerned about is what was a rising number of pCMs. When you go to a pharmacy, you don't know the ingredients, you don't know the efficacy about these products. All right, you've already set the deadline on the 30th of June, and I suspect that the CMB and the trade would have to think about it. I think that it should be the deadline, it should be final, and there should be no further extension. Because you've been doing this for 10 years or more, you can't say that, all right, there are problems and therefore you have to extend it. So either you come up with a definite deadline, which you think would be achievable. So either deadline A or deadline B. So like it or not, we will have to stick to the timetable. Only then will you be able to force the trade to meet the requirements, or else they will not be able to do it. So the CMB should have done it in accordance with the deadline. I don't know if there are difficulties. What are the difficulties then? In this regard, let me reiterate. In fact, the deadline was set by the CMB, and is the recommendation made by the CMB to us. And there are 2 parts to this. One, the time when they submit the report, that would be on the 30th of June. And the second part would be for the Bureau Director to gazette the specified date, and if you fail to register your pCM by the deadline, then the registration will become void. As the Honourable Member just said, we had to do it as soon as possible. I'd like to see if Dr. Lam has anything to add. Point number 1. Members' concerns will be passed on to the CMB, because in deliberating this subject, they will have to take into account the views from all sectors, including those from the trade. And I also hope that members would understand it. In fact, the law has stated that there would be this transitional registration. So they have completed the procedures. For example, even if there is a pCM which has passed the deadline, in other words, after June the 30th, if they have failed to submit a report, then they will have to have their registration cancelled. But then even if we try to do that, we will have to ensure that due diligence is done, i.e. is for the CMB to check with them why have they not been able to submit the report. And then the law has also promulgated a mechanism under which they can lodge an appeal. So you will have to understand it. So even if June the 30th deadline has been missed, it doesn't mean that under the law we can immediately exercise the power to cancel the registration. We will have to follow the due procedures. So that's the second point. And thirdly, other than conveying members' recommendations or suggestions to the CMB, I believe that the CMB would be looking into this as well. They will have to come up with some statistics so that closer to the date, how many have already submitted the report I'm sure the CMB will have to balance this with those who have fulfilled the requirement by submitting the reports on schedule. So they have already migrated from the HKP to HKC registration. And for others, for various reasons, they might have failed to submit the report before the deadline. So we have to strike a balance between the two. All in all, we'll be monitoring it closely. So we'll monitor the decision made by the CMB closely, and then we'll report back to members. Well, in the past, it's a bottom-up approach, so you'd rather listen to more views. But then on this occasion, I hope that it can be a top-down approach. So you will have to set a deadline. So it's like for the DFH to set a deadline, and then it would be easier for the staff to enforce it, because that would be their ultimate that would be something that they can go by, so that you set a deadline, and then by that deadline you will have to do it, and then the trade will have to follow the schedule or the timetable. For those who are not able to make it, that's another issue. Well, individually they can also lodge appeals, but then once the deadline is drawn, everybody will know what to do. Well, earlier on, when you decided to extend the deadline, there were various reasons. You will have to note that, for example, in the testing process and in the process of submitting documents, where is the bottleneck is with the laboratories. As we have said, well, for the testing laboratories that have been appointed, the number is limited, and whether or not they are able or prepared to accept the jobs. I understand that some laboratories are not willing to take on the job because it's very difficult to do the test. They are not making a lot of money, but then it's very time-consuming. And for some medicines or pCms, some laboratories might have encountered many difficulties. And I understand that the bottleneck is also with the DFH because of a shortage of staff. So in dealing with so many pCms, would they be able to cope? In the past, according to the paper submitted by the administration, from time to time, you will also have to update the standards and to update the requirements. And in your reply to us in para 7, well, under Cap 586, well, some might involve the protection of rare species and flora and fauna, and as a result, you will have to adjust the standards. So I think that would also give rise to some difficulties. Well, just now I said that it has to be top-down instead of bottom-up. Well, for the stakeholders, including the trade, and also the CMB, and also the testing laboratories, well, these are objective figures. After all the data are out, the administration will have to take a look and then draw a line. So I'm not suggesting that that should be arbitrary. So that has to be arrived at scientifically, so that the trade would think that it's reasonable, and then they would go by it, instead of just doing it casually or arbitrarily. All right, it's been so many years. I think you will have to resolve it once and for all. Can the Bureau give us a figure? How many have yet to submit their reports? Dr. Lam, there are two things here. First, I fully understand the sentiments of Mr. Yiu. That is, you will have to set a deadline, because balancing all interests, you will have to do it somehow. But then, given the powers and empowered to the CMB, well, it's the CMB which is responsible for the registration of pCms, and therefore, under the law, the ultimate power rests with the CMB. And if you look at the composition of the CMB, we have consumers representatives and also the trade representatives. So we will convey your views to them, and then they will come up with an objective and fair decision. And second, about the figures. Well, the Council is now doing the statistics. So in looking into this, we will tell them that we have to report to this Council, and I'm sure they would agree that they would come up with the statistics, for example, the number of those who have failed to submit the report on time. But then procedurally, we have to consult them first, that is the CMB, and they also have lawyers or legal advisors. Well, I have a question which has not been asked. Mr. Lee just said that migration from HKP to HKC is a transitional arrangement, and you said that you would allow for 6 months, and if it doesn't work out, then you will give them an extension up to 12 months, and they can also apply for another extension. But then still, you will not be able to resolve the problem of the need for recalls. All right, if the pCms, well, you do not allow for the same product to be marked as HKP and HKC simultaneously, right? So can the administration accept this suggestion? Can we give them can we give them a bit more time? And the administration must undertake to review the legislation. So by the time when the review is completed, they might be able to migrate from HKP to HKC. So is there a high chance that you can do it? Can you promise that within a short space of time, you can review the legislation? Well, for the migration from HKP to HKC is a one-off arrangement. So in due course, we will take a look at the current situation. As some members have said, if we were to look at the objective data, on this occasion, for example, if the CMC, in considering whether there should be another extension, or will it suggest that the Bureau Director should gazette a deadline? So, I mean, I have to look at the overall picture first, because if you say that we have to review the legislation and then amend the legislation, but then if by that time the whole exercise has been completed, then what's the point of doing it? We are talking about some 8,000 pCms waiting to migrate from HKP to HKC registration. And if every one of them has to go through this process, then basically we only have about 400 HKC registration. In other words, the whole system has just started, and there are 8,000 coming up, and they'll be facing the same problem. So, while most of the pCms have not yet migrated from HKP to HKC, what we have seen is, even if you give them a year or 2 years, in the end, they will still face this problem. That is, they will not be allowed to exist in both HKP and HKC forms, and as a result, there would be stockpiling of the inventory, or some would just take the risk of selling both registrations at the same time. So, would you be prepared to review the legislation then? Well, according to my understanding, well, Dr. Lam might supplement later. That is, within the CMC, well, they have got trade representatives. They've also consulted the trade before they came up with this arrangement. So for the extension arrangement, initially, the trade has welcomed that, and they're of the view that is agreeable. So, Dr. Lam?
Now, as the Undersecretary said, the trade basically accept the recall arrangement, but as the Chairman said, we cannot have old and new products being sold at the same time. Now there are regulatory requirements, but we don't want the public to be confused, because the same item might be in different packaging, so some people might exploit that. So when there is migration from P to C, for some products there are required changes. Some ingredients are found to be toxic. Let's be brief. Now, Mr. Lam may be straying a bit far. Now there are 8,000 products. Now, what I'm talking about is the trade does face a problem in implementation. This is now Mr. Lee said that the bulk of the trade accepts this arrangement. Maybe it's not entirely, they are not entirely at ease. Now, okay, so a further year's extension to migrate to C. Now, I'm glad to hear a legislation councillor tell us that perhaps there can be an amendment of the legislations to allow the products to be sold. Now, of course, we have a 5-year period for the migration by amendment of legislation. Of course, people will be able to meet that final deadline. Now, but I also understand the Undersecretary's point. But what I like to express is that no matter what is the final deadline, if it's the 30th of June, if people are able to submit the documents and meet the administration requirements, hopefully the cut-off date should allow those who have submitted the reports to migrate. Now, maybe you gazette is certain date, then we have submitted all the reports, and yet we have to come to a halt. Now, especially for those who have submitted the reports in time. So, as a member of the trade or as a representative of the trade, now, of course, I would be happy with amendment of legislation, but it has to be in time. Undersecretary, perhaps Dr. Lam can supplement. What I would like to say is when law is drawn up, it has to be a balance between the interests of the public and of the trade. You understand that the trade has a request and they suffer some inconvenience, but we try to make alternative arrangements to minimize the inconvenience to the trade. But if it comes to amendment of legislation, then it's difficult to reach the balance in the interest of the public. I don't know how that can be done. Dr. Lam? Now, if we allow HKP and HKC to be sold at the same time, there would certainly be a risk with regard to health. There would be confusion on the product, and some people might consume the product wrongly because it's the same, because of packaging. Then it poses a risk, health risk. Now, the P2C migration is one-off only, and the risk to the public health. Now, we cannot relax on that. If people migrate to sea, then they must totally migrate to sea, because there's a risk of public health involved. We understand that the trade does have difficulty, but we have listened to other members of the trade. They understand it's a one-off arrangement. It involves 8,000 products, but it's done in one go. Now, amendment of legislation is not by us. It's the work of the government. I hope that we will not give the impression that we are dumping a lot of pCms into the landfills, people see a lot of pCms being recalled. People from different parts of the world might find it very strange. Now, now you require people to recall all the P products, or to sell all the products within the time limit. So that arrangement, I think, is not the intent of the legislation. Of course, we cannot go back now, but I hope the administration would consider this is a requirement that is a great nuisance to the trade. Now you have 8,000 odd products, further to the 400 products that have migrated. So I hope that there is a more smooth procedure that can be more smooth. Maybe you should make the real effort. I think, Mr. Chen, as I said, any legislation has to be a balance between the interests of all involved, both the interests of the public and those interests of the trade. Public health is a consideration. Now it's a one-off transition. Not allowing two versions to be sold in the market at the same time is international practice. If we depart from that, it would be a problem. So we are trying to move in such a way so that we don't have to compromise the public interest. And at the same time, we would minimize the inconvenience to the trade. So that's the approach. That's why we adopted this approach. And now there's an extension from 6 months to 1 year, and then there can be another 12 months if there are solid ground. So there is a total 24 months extension, and whereas medicines have a 3-year shelf life. So I think the CMB has discussed with the trade and come to this decision after careful assessment. Okay, let's talk about this in 2 years' time, but then there might be more problems. So you have 2-year period for the government to amend the legislation, but the government is unwilling. Then we might have another problem. Sorry, time overrun. Our next meeting will be the 4th of May, as quite near. Next time we will discuss the registration of Chinese medicines practitioners, and we will also be discussing soon the Chinese medicine practitioners issue. So we hope to follow this agenda. Any comment? Thank you.